As literature on the prevalence of bladder cancer in patients with end-Lund is conflicting and no established screening protocol exists, the development of urine biomarkers for bladder cancer seems an attractive non-invasive method of screening in this patient population. The aim of this study was to evaluate for the first time the presence of DNA methylation of a panel of 5 genes promoters in the urine of patients with end-Lund. In literature, the selected genes were found to be hypermethylated in bladder cancer patients more frequently than in normal controls. This was a pilot prospective control study, and its primary outcome was to assess the prevalence of DNA hypermethylation of the RAS1, APC, RAR-beta, DAPK, and human TERT genes promoters in the urine of patients suffering from end-Lund for at least 5 years, and compare the results with results from normal individuals. For study purposes, 50 ml of urine were collected, and quantitative methylation-specific PCR was performed to detect changes at the promoter of the selected genes. In results, finally, we enrolled 33 patients with a mean age of 48 years. Most of our patients were suffering from multiple sclerosis and spinal cord injury with a median end-Lund duration of 12 years. The majority of our patients were used sick to empty their bladders and had a history of UTI. DNA was found to be hypermethylated in at least one of 5 genes promoters in almost 40% of urine samples, in 11 of 28 samples with detected methylation. Most of patients had one gene hypermethylated, and the most frequently hypermethylated gene was RAS1, followed by the APC. DNA was found to be hypermethylated in 3 samples, in 30%, all in RAS1 gene promoter, and when comparing the two groups, DNA methylation was found to be significantly more common in end-Lund patients than in controls. In conclusion, in this pilot control study, end-Lund patients were found to have significantly higher percentage of DNA hypermethylation in a panel of 5 genes which have been previously associated with bladder cancer, compared with normal controls. Thus, larger, longitudinal studies are needed for a better understanding of the association between DNA methylation and bladder cancer in end-Lund patients. Thank you.
Congratulations, because it's an interesting topic for people that work with a neurogenic patient. But you have a group of control or not?
Yes.
And
it was 35 patients, but we detect only in 22 DNA, so...
Yeah, it's lower.
So one of my requests is to explain, do you hypothesize that it's a result of their neurogenic dysfunction that you're identifying a difference, or is it the consequent need for bladder management, like the intermittent catheterization and urinary tract infections, which is clearly more prevalent and which you did capture?
We think that maybe it's a risk factor for bladder cancer, because
which is the risk factor? The neurological disease or the management of the neurological disease?
We don't know.
They have all the same kind of management?
No.
There were people with avoiding people. The 5 where you didn't find the same DNA have the same kind of management of the other.
Due to the small size, we can do a statistical analysis for these different groups with intermittent catheterization and without, and with an indwelling catheter.
Do you propose to continue your studies and to get the bigger cohort to allow the statistical analysis which will be needed for publication?
Yes, but most of our patients, I will think that we used sick, so maybe we don't know if we managed to find a lot of people with indwelling catheters.
Yeah.
Yes, but go on because you need to know much more about this.
Just to continue on what Pericles is saying, we were actually expanding our sample size. We've exceeded how many patients now? 70 or 80?
6 patients.
60 patients. But we don't. The majority of them are CISC, so we can actually cannot say that this is due to CISC or the neurological condition yet. You need to have a prospective study designed like that. But since the majority of patients are on aided voiding function, then avoiding emptying, then it's difficult. You need to design a study, probably multi-center.
Yeah, absolutely.
Yes. Also because in my clinical practice, usually patients that maintain this synergic voiding without intermittent catheterization are people that have more probability to have bladder cancer. But this is just an observation. You can go on to the next. Please go.
Okay, so thank you very much indeed.
Thank you.